Okay, so continuing on with the different views of the skull and what we can see in those views, we're going to start off with the internal view. So basically, we've cut the skull in half, top to bottom. Okay, we've taken off the top of your head, and now we're going to look down into the inside of the skull. All right, or what we refer to as the cranial base. Okay, so one of the bones that we'll be taking notice of is going to be the frontal bone. And on that frontal bone, you'll see kind of in the middle of it, the ethmoid bone. All right, and surrounding the ethmoid bone, kind of like an island, right? The frontal bone is the ocean, and the ethmoid bone is floating in it, right? And like the beach of that island would be the cribriform plate. Okay, and the cribriform plate is essentially this area that surrounds the ethmoid bone and has all these holes in it. Okay, and all these holes are spaces so olfactory neurons can travel down into the ethmoid bone, and they're found to be at the top of your nasal cavity. So kind of like this structure here, that's called the olfactory bulb, and you have all these little neurons, all right, that are traveling down, and then in this kind of circle that I'm drawing, that is your cribriform plate. These neurons go down into here, and then in this region here, this is the superior region, all right, superior region of your nasal cavity, like the top of your nasal cavity there. Okay, and that one kind of shark fin structure that you see on the ethmoid bone, all right, comes off, looks like that from the side, all right, that's called the crystal galley. Now we'll talk about this later on when we get into the neurological part of this class. But you have this dense, regular connective tissue that separates the left side of your brain from the right side of your brain. Okay, and that's called the dural septa. All right. So it attaches onto the cribriform plate in the front here. And I'll remind you of that when we go over the different types of, when we go over the dural septa. Just keep that in mind. This dural septa here is this tissue, all right, that helps to divide the left part of your cerebrum from the right part of your cerebrum. So here we can see the internal view here, all right. So all this up here is the frontal bone. You can see right there, all right, in the frontal bone, you have your ethmoid bone that's below it, but on either side of the crystal galley, that's this kind of tannish structure here, right, you have your cribriform plate. And you have all these little holes in it, and those holes are called the olfactory foramina. Okay? You can see here's our sphenoid bone. So all this is the frontal bone here. And then on either side of the frontal bone, all right, you can see right here, that's the cribriform plate. All right. A couple other structures that you can see, obviously, are the sphenoid bone. We've got our greater and lesser wings of the sphenoid. Right? And then if you remember this structure here, the sella turcica, which means Turkish saddle. And when we're looking at the sphenoid bone from the side, the Turkish saddle, the sella turcica, looks like this. And that's where your pituitary gland sits. Sits right in there. Okay? And then up above that is the hypothalamus. Okay? But anyways, this pituitary gland is a very important gland. You'll talk about it in chapter 17 in regards to endocrine function. All right? Helps to regulate some of your adrenal hormones that come from the adrenal gland. Thyroid also helps to secrete oxytocin, all right, which is a hormone that helps with uterine contraction and milk ejection, all right, in pregnant, well, in moms that just had babies, all right. So the pituitary gland sits right there inside that sella turcica there. And then just a little bit further on either side, we have our optic canals, and that's where cranial nerve 2, all right, CN2. That's the nerve that comes off the back side of your eyeball. Okay, it comes from the eye and it heads back towards the brain here. So that's what we're seeing here in this view. Okay, so you can see here's the cell. Well, let me go back to. Let's see if I run this one. Okay, so here's the sphenoid bone. All right, then you got your greater wing down in here on either side. Your lesser wing up here. All right, and then you can see here's the sella turcica. Sits right there. And that's where your pituitary gland will be. And then in here, we have our optic canals, and that's where your second cranial nerve 2, all right, was that nerve travels right towards the eyes. Because the eyes sit right underneath this portion, all right, of the frontal bone, here and here. So that cranial nerve 2 will just attach onto the eyeballs. All right, let's run through some. Wait, is this? Hold on one second. Give me a second. Oh yeah. All right, let's do a little review. You guys ready? Okay. Frontal bone. All right. If you want to get your atlases out and just double check everything, because you're going to see, all right, some of these slides. And there's a couple, bless you, a couple of incorrect things on here, and I will mark those out as we go along. All right, here is your frontal bone. Like this one is incorrect, so don't write that down. All right, that is a notch. Okay, so that is the supraorbital notch right there. All right, so you get your supraorbital margin. Okay, that's that border right here. You can see it's more pronounced in men. All right, then you got a little kind of white out of the bone here. All right, it's not a complete hole in the bone, but that's the frontal notch. The flat portion here of your frontal bone, that's the frontal squama. Okay, your forehead there. Here you can see a better example. Here's a notch. Here's a notch. But this right here is the supraorbital foramen. You should have all that, right? Good so far? Yes, sir.
I have one question for like just test purposes. For the frontal squama, will we for labeling all this stuff? And it says ID this, would it be the frontal squama? Like this is the frontal, I'm assuming.
Yeah. Well, let me ask you guys this because I asked my other section this last night. When you were taking the lab exam, were you in the habit, or did you at least look to see if there's any words for the test? When a slide popped up, were you able to look? Okay, good. Okay. So I'm not really quite understanding your question. You're asking me if it'll ask you if it's the bone or
like the flat, the flat part, or if it's the whole frontal itself. Is what it's asking for. I'm not going to ask like specifically what's that part.
What it'll have an arrow pointing to that spot.
All right, just making sure.
Yep. And then if it wants you to be, usually, if the arrow's pointing to that spot, you should put frontal squama. If it says what bone is this, then you would say frontal bone.
Okay. I just want to make sure.
Yep. That's a great question. Do you folks know what bone this is here? Nasal, right on. Good. I like it. Okay. So you can see here, all right, again, this is incorrect. Not the supraorbital foramen. Okay. That's the frontal, that's the supraorbital notch. Okay, over there. All right. Now we're going to talk about what we can see for the parietal bones. All right, so here you can see the parietal bone that's all by itself. Normally, I don't like to ask the parietal bone unless it's on the skull. Okay, when you just see this here, it's really just hard to tell if that's a parietal bone. But still, we make you do it anyways because we like to make your life harder. All right, here's your temporal bone. Okay, we're going to see several structures, but I want you to get used to seeing it. Here on the lateral view, and then here on the sagittal view, all right, on the inside of the skull. So you can kind of see down here, that's the occipital bone down here. All right, so just to kind of give you a general, all right, understanding of the inside of the skull, all right, because back in here, that's not going to be the best. When I'm putting the X, that's the occipital bone. And then over here, that's going to be the, I'll put a P there for the parietal bone. And then this over here is going to be the frontal. To kind of give you a little bit of a general idea. All right. So let's label here our temporal bone. You should have all this labeled. Okay? Now, I've told students you can write the external acoustic canal there, all right, but most people will usually just put external auditory canal. That's why I think we had that labeled, correct? Yeah, yeah. Another name for it is the external acoustic canal. All right, so here's your styloid process. This is the optimal view, in my opinion, to see the styloid process, all right, because you can see it hanging down like that. The nice mastoid process here in the back, all right. Now you can see the mandibular fossa. All right, that's going to articulate with the condyle of the condylar process of the mandible, all right, to make the temporal mandibular joint. Right. And then here you can see the zygomatic process of the temporal bone. Good so far? You should probably have all this down. Okay, okay, good. All right, let's get that. All right, let's talk about the zygomatic bone. So this right here is showing you, all right, the two processes. All right, that blue line is the suture line where the zygomatic bone articulates with the temporal bone. Okay, so anything on the right-hand side of that blue line that I just drew, that's going to be the temporal process of the zygomatic bone. Right? Anything on the left side, all right, of that line that I just drew is the zygomatic process of the temporal bone. Do you know how you guys understand how to name that? All right, you should never have the same name twice in your answer, meaning you should never say the zygomatic process of the zygomatic bone. You should not have that. Or the temporal process of the temporal bone. Okay? You should remember, the process, you name the process to which the temporal bone is articulating with. Okay? That's just telling you to which bone that the temporal bone is articulating with. Okay? So when you see this structure, all right, this red or black oval around the whole entire structure, and it's including both processes, that's the zygomatic arch. Okay? I just don't want there to be any confusion on that. All right. Then we can see, and I'll outline, this right here is the petrous part or the petrous portion. That was a horrible drawing. Hold on one second. All right, that's the petrous part or the petrous portion, okay, of the temporal bone. All right, on both sides there. Now, staying on the inside of the skull here, this whole thing, okay, is the petrous part or petrous portion of the temporal bone. All right, now we'll take a peek at the inferior view here. All right, you should have all these labeled except for this one. That should not be the crest, okay? That should be the, let's see if I spell this right. All right. Tuberance, the external occipital protuberance. All right. Foramen magnum, jugular foramen is immediately lateral to the foramen magnum, and then anterior to each jugular foramen is the carotid canal. Carotid canal contains the internal carotid artery. The jugular foramen contains the internal jugular vein, and some nerves will travel through, all right, that space. And that's why it's a little bit bigger, because we have more than one structure coming through. All right, on to the occipital bone. Okay, here you can see the occipital bone on the bottom portion of the skull here on the on the inferior view. So it makes up basically the base of the skull. You can see it here on the lateral side. And then on the internal cranial base view here, you can see how much it makes up down in here. Okay. All right, here's the bone all by itself. You should be able to identify the occipital bone like that. And now we'll run through a couple of the structures here. There's the foramen magnum. All right. To the lateral sides of the foramen magnum, those are your occipital condyles. I'll outline them here. There's one, here's the other. Those will articulate with your first cervical vertebrae. The first cervical vertebrae is called the atlas. Okay? Here you can see this little bump here. You can feel it in the back of your head. External occipital protuberance. All right, now you can see the whole skull here on the inferior view. There's the foramen magnum. This is the, not the crest, but the protuberance. I'll just put PRO. And P. Okay, that's the external occipital protuberance there. And then you can see your jugular foramen on either side. And then the carotid canal is just in front. Good so far? Okay. Here we go with the sphenoid bone. This is a lot of times people don't really focus too much on the lateral view here of the skull and realize that the sphenoid bone sits right above the zygomatic arch. So kind of commit that, all right, to your knowledge brain pan there, okay? So you got the frontal bone here, okay, and then you got the parietal bone here and the temporal bone here. Remember when we were talking about the fontanelles? And one of the fontanelles that you had to know, okay, was the squamous, okay? Did I say squamous? Excuse me. The squamous suture. It was the sphenoid fontanelle, and that's because, all right, that's where the sphenoid bone is, all right? So you can see it here on the inferior view on either side of the nasal cavity here, and then obviously we're all pretty familiar with the internal view, okay? All right. Here's the sphenoid bone all by itself. Let's do a couple labeling. The lesser wings of the sphenoid here. All right, the top portion of the sphenoid bone. And then you can see the greater wings down in here on either side. All right, see part of the superior orbital fissure here and over here, and then the optic canals. All right, this one you can't really see the superior orbital fissure because the lesser wing is overhanging there, but you can see the optic canals here on either side, all right, medial to the lesser wings. All right, so on the sphenoid bone here, this is the sella turcica, this whole area right in here. All right, this is an anterior view of the sphenoid bone. You don't have to know for identification purposes the lateral medial pterygoid plates, but you do need to know the pterygoid process here. Okay, is that labeled? You guys have that? Okay, good. Okay. So again, you don't have to know the individual plates. You just need to know the whole structure, all right, within that circle that is going to be referred to as the pterygoid process. I'm just trying to show you all the different ways that we can ask you this. This next slide sometimes gives me nightmares. All right, this is a freaky looking bone right here. Okay, but just to kind of give you a little bit of appreciation, this right here is the superior view of the ethmoid bone. When it's embedded into the frontal bone, this is all that you'll see from that superior view. All the rest of what you're seeing is underneath the frontal bone. Okay, all right. So here you can kind of get a little bit of an appreciation here on your models. There's the crista galli in the center, and then on either side of the crista galli is the cribriform plate. All right, there's the ethmoid bone from the lateral view. So you should have that labeled as the crista galli. Do you guys have this one here, this view in your book? I know you have one. Yeah, I know you have this view, but I didn't know if you had this one there. You do have that one. Okay, okay. All right. So one of the things that you want to label, obviously, I know I talked about it in this view. The center, process here, that's the perpendicular plate of the ethmoid. On either side, I didn't have you guys label this, but these are the middle nasal concha. Remember, we saw the inferior nasal concha, okay? But this is the middle nasal concha, here and over here. All right. So you can see now a little bit better of an understanding. Here's the inferior nasal concha, and then just above it, this is the middle nasal concha here and over here, and then you got your perpendicular plate. So pretty much I'm going to draw this blue line here. Everything above this blue line, all right, of the nasal septum is going to be the perpendicular plate of the ethmoid bone. All right, let's do some, does everybody have that? You good? Okay. Let's do some bones of the face here. Okay? Nasal bones, bridge of your nose, right above the opening to your nasal cavity there. All right? Zygomatic bone. Here are all the different views. Lateral view here, okay? Inferior view, and then a frontal view. So the zygomatic bone makes up, all right, the inferior 2/3 of the lateral margin of your eye, of your orbit, okay, or your eye socket there. All right, I do believe you have a picture of just the zygomatic bone there, okay? So this zygomatic bone is not in the correct anatomical position, okay? So I'm going to test you guys. Looking at this thing, all right, is this the left or the right zygomatic bone? Now remember what I said. If you look on this bone, okay, before you answer, this margin here is the nice smooth margin. So this is on the lateral, okay, lateral inferior 2/3, all right, of your eye socket there. Okay, so and remember where your zygomatic bone is. It's part of your cheekbone, right, more towards the front here. So it makes up that lateral portion there. Okay, so before you answer and figure it out, let's look at this. Now to kind of give you a little more perspective here. All right, so now we've named all the processes. The long, slender one, it's traveling up towards the frontal bone. That's the frontal process. We saw this one already, the temporal process. This is going back towards the ear. And then this wider one, all right, that's the maxillary process. That's going to go more towards your mouth and your nose. So again, which side do you think this is? You think it's the right? All right, now we flip it up. Okay, now remember what I'm saying. This is going towards your mouth and your nose. This is going back towards your ear. This is going back towards, not back, but up towards the top of your head. So you want to stick with right, or do you want to change your answer? This one right here. Yep. For those that answered left, you are correct. Good job. Yep. Do you see that? And now we'll put it. I don't have the left side of the. Oh wait, nope. Of course I don't have the left side. All right, I'm not going to scroll through this whole thing. Now I'm tempted to that one.
I think most views are taken from the right side of
Yeah.
these slides.
Yep. Oh, did I skip? Yeah, I did. All right. All right. Well, this one here you can see. This is obviously this is the right. Okay. Because we're looking at it on the right side. But again, now you can see it in the bone in its actual anatomical positioning here. Okay, so remember the frontal process is going to be the more slender one and longer process. All right, and in the maxillary process, it's much wider. It's going towards the mouth and the nose. Okay, so that's this guy here. And then the one that's kind of, it's not as long, but it's not as skinny, all right, that's the temporal process, and that's going to be going back towards the ear. All right, there's our zygomatic arch, right, with the two processes involved. One of the other bones you need to know is the lacrimal bone. So here are our nasal bones. Then you have your maxillary bone, and then right behind the maxillary bone, this is the lacrimal bone. I haven't shown you this, but this back right here, this bone right here, that is the ethmoid bone. The top roof portion, the top bone to your orbit is the frontal bone. Okay, and then you can see this is the zygomatic bone that makes up some of the lateral margin part of the floor here of the orbit, and the maxillary helps to make up the remaining part. And then this guy back here, that's your sphenoid bone. Okay, part of the sphenoid's back here too. But this is the superior orbital fissure, and we saw the superior orbital fissure inside the sphenoid bone. Okay, so the sphenoid bone sits on either side. And then this right here is your optic canal. Okay? All right, again, it's tough to see, all right? Don't worry about the lacrimal groove or the lacrimal sulcus. It's tough to see on this model, all right? You can see the lacrimal bone much easier when we're using these color-coded models. All right, vomer. Here are the three different views that you can see the vomer from. All right, makes up the inferior posterior portion of the bony nasal septum. You can see it here on the inferior view of the skull. And then when we have a sagittal view, right, it sits at the bottom there. You can see it right there. All right, inferior nasal concha, we've already seen that. Now we'll give you all the different structures. You should have all this labeled. Agreed? You guys labeled all that? Cool. What's this structure right here? Supra. That's right. Supraorbital foramen. Yep, not superior, but supraorbital foramen. This is the supraorbital notch right here. Good. Good, 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 good. What's this structure here? No, this is the superior orbital fissure.
Oh, okay.
Okay, the oblong opening here. So that's the fissure. All right, let's look at another bone called the palatine bone. Okay, this is one of the bones that helps to make up the roof or the hard palate of your mouth. Okay, the front anterior 2/3 was the maxillary bone. And we refer to that actually as the palatine process of the maxillary bone. And this part back here, all right, that's the palatine bones here, but this flattened portion is referred to as the horizontal plate of the palatine bone. Okay? Do you have this in your atlas? Okay. If you don't, I couldn't remember if that was in there or not. But this is actually the entire palatine bone. But the flattened portion here, oh, you do have it? All right, that's what I thought. Okay, okay. All right, so just understand this flattened portion, that's the horizontal plate, okay, that makes up, all right, the back portion of the roof of your mouth, the hard palate. Okay, but the palatine's bone, you can see they kind of curl down into the nasal cavity here. Well, that's all this. All this kind of surrounds the nasal cavity. And then you can see there's the horizontal plate on this model that you have in your book. So pretty much everything below that line is going to be the horizontal plate of the palatine bone. And then everything above that line is going to be the palatine process of the maxillary bone. All right, let's talk about the maxillary bone or the maxilla. And here you can see in the anterior view here. All right. And we'll take a peek here from the lateral. Okay. Lateral portion, and then the inferior view here. All right. So where your teeth enter into the maxillary bone, you have those little bumpy ridges there. Those are the alveolar processes of the maxilla, or you can call it the maxillary bone. Okay. Those grooves. You can see it a little bit better on this one. Okay. And then on the anterior view, you can see it quite well. And then you got these two holes underneath the eyes, orbits there. And those are the infraorbital foramen. So if you have a supraorbital foramen, you'll also have it. Then you can have an infraorbital foramen right below it. What structure is this right here?
It's the
Which one?
that's the right nasal cochlea.
Well, the middle. You don't have to be that specific saying left or right, but that is the middle nasal concha. Yeah. Cochlear, you're thinking ear. You're in chapter 16. Don't go fast forward. You're traveling too far in the future. Unless you want the semester to be over with already. All right. I'm sure a lot of people are ready for the semester to be over with. It just started. All right. Here's the maxillary bone, or part of the maxillary bone. Specifically, this is going to be the palatine process. And this kind of shows you, all right, a little bit here, okay, the palatine. This is showing you that this is all part of the maxillary bone, all right? But the palatine process is everything, like I said. Well, that's probably a little bit too high. Like here. There we go. So like all this flattened portion, right, the hard palate, the roof of your mouth, that's the palatine process of the maxillary bone. And now we'll add one more thing in there. There's the horizontal plate of the palatine bone. All right, let's run through the maxilla here, or not maxilla, the mandible, and then we'll start labeling some new slides here. All right, so you can see the lateral view. This is a nice sagittal view, lateral view, anterior view. Okay, you have all these structures here labeled. Okay, remember how to spell this one. There's 3 O's in coronoid process. All right, that's that sharp fin-shaped structure. You got this little dip, that's the mandibular notch. Then you got part of our TMJ, the condylar process of the mandible. Okay. Then you've got the ramus, which is this vertical portion of the mandible. All right. And then we got the body, which is the horizontal portion, this part over here. Right. Then we have our own alveolar processes, but they have to be labeled as the alveolar processes of the mandible. Then we got our little hole here, that's the mental foramen. All right, and then you can see the mental foramen, well, you can see the body of the mandible here on the anterior view. There we go. Then you can see our nice alveolar processes of the mandible, and then our mental foramen, one over here, one over here. And then you should have this one here, right, kind of drawn in on your model, but that's the mandibular foramen. That's on the inside of the mandible. All right, let's wrap it up with the sutures here, and then we'll label new stuff. Frontal suture here divides the frontal bone from their 2 parietal bones. You got your lambdoid suture here in the back. Okay, that's going to divide your occipital bone from your 2 parietal bones. And what's the name of this suture here? That's the sagittal. Very good. It runs from the lambdoid suture in the back to the coronal suture in the front. It divides your 2 parietal bones. Here you can see it without the lines overlapping. All right, so you can see there's the sagittal suture. We'll make it disappear. There it is. And then we'll look at your squamous suture here on the side. And then you have this phenomena with the sutural bones. Those are just secondary ossification centers there. All righty. Let's go on and label some new stuff. Okay. We'll stop sharing this. All right. All right, we're getting on to one of my favorite parts, the spine. Okay? I know a thing or two about it because I've seen a thing or two about it. Okay? You know the commercial, the Progressive commercial? Oh, wait, no, that's not the State Farm one. We know a thing or two because we've seen a thing or two. No. It's a newer insurance company one, but they have all these weird things going on. It'll come to me. I see it all the time. All right, so let's talk about the spine, the vertebral column. Okay, couple things that you want to know. First of all, it's made up of 24 individual vertebrae, okay? And you've got a fused structure at the bottom, the sacrum and the coccyx. Those are, now when you're younger, Farmers Mutual, thank you. And now that song's gonna be stuck in my head. Bum, ba, bum, 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 bum. And now it's stuck in your head. You're welcome. Okay, so you've got 24 individual vertebrae, and then you have the fused sacrum, because at one point the sacrum used to be 5 individual vertebrae, and then they fused over time. And the coccyx, which is often called the tailbone, all right, that was any period of time 3 to 5 individual vertebrae that also fused. And then over time, the coccyx will fuse to the sacrum. All right. Point being is, okay, that your sacrum and your coccyx, those vertebrae have fused. But in adults, all right, we're going to count them as 2 separate bones. Okay. All right. So how it works is one vertebrae in your vertebral column will articulate with a vertebrae above it and a vertebrae below it. Okay. So the one above it is the superior vertebrae. The one below it is the inferior vertebrae. Keep that in mind, because when I start talking about different vertebrae, you need to know superior and inferior. All right. Big function for the spine, other than protecting the spinal cord, is to provide vertical support for the body. Okay. Upright vertical support. How you're able to sit upright, stand upright. That's the vertebral column. Also part of that, because your head sits on top of it, it has to support the weight of your head, okay? But the most important part of its functionality is how it protects the spinal cord, okay? Because the spinal cord is the part of your central nervous system. Without it, you're not alive, okay? You're dead. All right, so here's a couple views of our vertebral column. Looking at it from the back, okay, relatively straight, hopefully without a person without scoliosis. Here's it from the front, and then from the lateral view, the side view, you notice that it's got almost like this kind of S-shaped configuration. That's the normal configuration that you want to see in the spine. And believe it or not, all right, it's quite amazing if you look at it from an engineering perspective. But people often, and I did too, it's like, why isn't the spine just straight? Why does it have to have these curves here, these wavy curves? And they found out, engineers have found out, that this configuration actually makes the spine stronger, okay? With the addition of the vertebral cartilage, all right, the intervertebral discs there, all right, fibrocartilage, this configuration is actually stronger than a straight up and down configuration, okay? I'm not a physicist. I'd love to be, but I'm not an engineer. I couldn't explain it to you well enough, but that's what I know. All right. So there's 5 regions to the spine. You need to know these. Okay. The first and topmost region is the cervical region. It consists of 7 vertebrae. You need to know the names of the region, and you need to know how many vertebrae are found in each region. All right. The middle region, not the middle region, but the lower region there. Right, this is considered to be your mid-back by most, is the thoracic region. It has 12 vertebrae. How many pairs of ribs do you have?
7.
12, actually. 12. Yeah, you got 12 pairs of ribs. So all those ribs attached to thoracic vertebrae. Okay? That includes the floating.
How many floating are there again?
2. 2 pairs. 2 pairs.
2 of them, okay.
Yeah. Then the low back region, easy to remember. L, lumbar, L, low back, all right, it's the lumbar region, and that has 5 vertebrae. And then way at the bottom, all right, we have 2 more bones. You have your sacral region, okay? And again, at one point, it used to be 5 individual vertebrae, but they fused. Okay, so you have your sacrum, and then you have your coccygeal region, that's your tailbone, okay? And that's 1 bone. Okay, so please learn those regions, all right? Become familiar with those regions, and you need to know how many vertebrae are in those regions. All right, let's talk about the curves here. All right, so you heard me mention earlier that there are curves to the spine. So you have what we call primary curves and secondary curves. The primary curves are the curves that you're born with. Okay, so when you're a baby, and this is going to be you looking face down, you have one big curve, like that, okay, for your little legs, okay, and your little arms. All right, that's you, okay? So you're born with a big C-shaped primary curvature, okay? But as you develop and you go through the milestones of life, when you start to hold your head up, then when you start to sit up, then when you start to go walking around, you'll start to develop your secondary curves, okay? So the curves that you're primarily born with are your thoracic curve, so this big curve here, that's a primary curve, and your sacral curve. And if you look at it, it's almost like one big curve here, except for one thing. The lumbar curve is curved in an opposite direction, okay? No problem. So when you develop your secondary curves, you notice that the cervical is a secondary curve and the lumbar is a secondary curve. So what do you think makes the cervical a secondary curve? What does a baby first do? Starts to hold its head up. Yeah, when the baby starts to lift its head up and hold its head up, that's when it starts to develop the cervical curve. Okay, and you can see that the thoracic curve is going back like this, and the cervical curve is going forward like that. They're two opposite directions. So as the baby starts to hold its head up, and sitting, well, yeah, and sitting too, but by then they hold their head up first. And then when they start to stand, that's when they develop the lumbar secondary curve, okay? So it's primarily when the baby holds its head up, and then when the baby starts to stand, it will develop the lumbar secondary curve. So here's a couple abnormal curvatures of the spine, okay? You've seen this in more elderly folks, and we're seeing it more at a progressive rate because people are having horrible posture more often because of this, sitting at a computer, on smartphones, all right? So you're seeing more of a development of a kyphosis, all right? So you'll see an accentuation of the thoracic curve, and then you see this is also called a sway back, but this is a lordosis. This is when you see an accentuation of the lumbar curve in the low back. Then I think we're all familiar with this last one here, scoliosis. Scoliosis is any type of lateral curve in the spine. There's the conditioned scoliosis, all right? And then with that, okay, the scoliosis condition is, there's two things. There's idiopathic scoliosis, which 90% of people, we just don't know. We just don't know what's causing that scoliosis. All right? And there's secondary scoliosis. Like if one hip is higher than the other, then the spine compensates for that. Because you always want to see everything on the horizontal. Everything wants to be on the horizon. And so if one hip is higher than the other, if my spine is straight, so my right hip is higher than the other, if my spine stays straight, I'll be like this. Well, I'm not going to walk around like this. I don't want the whole world to be crooked. So my spine compensates to put everything on the horizon there. So it puts these compensatory curves into the spine, and that's a secondary scoliosis. That's what we're kind of seeing here with this lady. Because her eyes are always going to be looking at the horizon here, so her body's had to compensate. Okay. Let's start labeling. Very first, all right, vertebra in your spine, okay, is C1 or atlas. Either one of those are acceptable. Because remember, there's 7 vertebrae in your cervical spine. So the first one we call C1, because that's how we name the vertebrae. We'll use the first letter of the region that they're in, and then we assign them a number. Okay, so the one that's closest to the skull is assigned 1. Okay, the last vertebrae in the cervical spine is C7. Okay, anyone heard of Atlas? Who was Atlas? He was my uncle. Just kidding. If you're familiar with Greek mythology, who was he? He was a titan. He held the earth on his shoulders. I think the gods and the Titans fought each other. I can't remember. And then the gods won, and then the Titans were banished or whatever. Yeah, Atlas of Anatomy. That's right. And so Atlas, his punishment was to hold the earth on his shoulders. All right, staying with the Atlas, these flattened structures here, those are called the lateral masses. And the lateral masses accommodate the occipital condyles. Remember the occipital condyles on the occipital bone on either side of the foramen magnum? Okay? So the lateral masses, if you look at them from the side, look like this. They're like a cup. And then the occipital condyle sits right in here. And it creates what we call the atlanto-occipital joint. And its main movement is this. Yes, dear. Yes, dear. Okay? And that's what it does. Okay? All right. The second vertebrae is this nice fella. Okay? That is the C2 axis. All right? Either one's acceptable. You should have that. Or do you have that one or this one? You don't have either one of those?
No, like a posterior view.
Oh, darn it. All right. All right. Anyways, this is C2 and axis. This little nubby structure right here, that's called the dens. All right. This, you do have this one in your book, right? Okay. Yeah, so this is the dens right here. It's also called the odontoid process. Which one would you rather spell for the test? Dens. Right, exactly. So just want to make sure you're getting your money's worth here, all right? It's also known as the odontoid process. All right, so what you're seeing here is C1, that's this guy, that's the atlas, and C2, that's this guy here, all right, articulating with one another, okay? So you can see how C1, all right, sits in front of the dens here, and it creates a joint right in here, okay? And that joint does this. No way. Okay, most of you shaking your head from side to side, 90% of it is from this joint here. Well, that's, yeah, it's about 90%. I was gonna say that's a little bit high, but it is. Okay. All right. This, oh, and I also want to say, we'll learn the different parts of the vertebrae here in a moment. But this back structure here that comes off of a vertebrae is called the spinous process. When you see that a spinous process has these two little nubbins on it, all right, we refer to it as a bifurcated spinous. All right, I'll show you what a regular spinous process looks like in a moment. But when it has these little nubbins hanging off and two on either side, it's a bifurcated spinous. It's also referred to as a bifid spinous. Okay? That's like the abbreviated form of bifurcated spinous. Bifid spinous.
I'm assuming that that's what you want. Bifurcated spinous cells, probably.
No, it's easier that way. You can put bifid on there. Bifid spinous, you could write that on there. I might mark it wrong. I'm just kidding.
Oh, okay.
I'm kidding. I'll never do that to you guys. All right. So the next one. This is now, all right. So from this point on, we're going to go through and we're going to label a bunch of these vertebrae. And we refer to this as a typical vertebrae, meaning that all the other vertebrae, all right, C1 and C2 are what we call atypical vertebrae. They're funny shaped. They have something special about them. But all the rest of the vertebrae that we're going to go over have all these in common, all right, which means they all have a vertebral body. They all have a spinous process. They all have a transverse process. I'll go through all this with you, all right? And they all have what we call pedicles and facets and laminas, okay? So we'll go through that. I just want to explain that, the difference between an atypical vertebrae and a typical vertebrae, okay? All right, here are the three types of vertebrae in the different regions of the spine. Cervical, thoracic, and lumbar. Now take a look at this. This structure right here is called the vertebral body. You notice All right, we're up in the neck here in the cervical area, and then we get down to the low back here. Look how the vertebral body gets bigger. Right? Small, medium, large. You guys see that? Okay. We also will see that here in the cervical vertebrae, we have these holes here. We don't see that in the other two. Okay. So you want to know, all right, these differences, okay, that are found because I've seen it asked on the test before. They'll put one of these vertebrae up. Like here's an example. They'll have this vertebrae up, and they'll say, what region of the spine is this found in? Thoracic, right. It's the thoracic, this one right here, okay? We know it's not the cervical because it didn't have those holes there, right? And we know it's not the lumbar because the vertebral body was kind of small. This is small, lumbar is big. And the spinous process is pretty long here in the thoracic vertebrae, but it's kind of shorter here. Look at the thoracic compared to the lumbar, okay? Thoracic is longer, lumbar is short. Point being is, we'll see it. We're going to go through a bunch of these, and you'll get the picture. Okay, so you guys do have this one in there, yes? Okay, cool. All right, so the axis, or C2, this is C2, all right, it also has a vertebral body, okay? Here's the dens, and the dens sits right on top of the vertebral body. Now what we're going to do now is I'm going to show you a typical cervical vertebrae from the lateral view. Okay, so this is the vertebral body here and over here. Now the best view to show you the vertebral body, I think, is here. Okay, that's this whole structure here. That's the vertebral body. So now I'm going to show you the vertebral body. I'm going to pretty much show you the structure, and then I'm going to show you it in all the three levels there. Okay, so here it is in the cervical area. Here it is in the thoracic, okay? And then here it is in the lumbar. And I'll even show you laterally. Good so far? Okay. So now I'm going to show you a structure here called the vertebral arch. And the vertebral arch, all right, is this portion of bone that sits all along. This is called the vertebral foramen, this hole here, all right? And the vertebral arch sits on the back side of the vertebral foramen, all that. All right, this is the cervical vertebrae vertebral arch, but now you don't have to write that. You can just say vertebral arch is your answer. Now we'll see it in the thoracic, okay? And then now we'll see it in the lumbar. And you can see it's an arching structure. All right, so now I'll show you the whole. Vertebral foramen. Okay, that is where, now, when you have one single vertebra, you refer to that as the vertebral foramen. If you stack several vertebrae on top of one another, then we call it the spinal canal, because guess what travels in that? Spinal cord. Yeah, okay, spinal cord. All right, so there's the vertebral foramen there. Here it is in our thoracic vertebra. So you can see these terms that I'm showing you right now are going to be used in the cervical, thoracic, and lumbar. They're common for those regions of the spine. And here it is in the lumbar. Okay, now we're going to go back up into the cervical area, and you can see, all right, this structure here. Again, we know what a process is. It's a projection of bone, all right, and this is called the transverse process because it's going off to the side. Okay, it's going off to the side. So here's our transverse process on C1. Okay. And then this is it on C2. I don't think you guys don't have that, but if you can draw it on one of your C2s, okay? And then here's the transverse process on a regular or typical vertebrae, a cervical vertebrae. All right, let's go down to the thoracic. Here it is on the lateral view for the thoracic. Now, just to show you, all right, we haven't labeled this structure yet, but this is the spinous process. See how long it is? It's one of the qualities or characteristics of a thoracic vertebrae. Long spinous process. All right, here's the transverse process on the superior view of the thoracic vertebrae. Now notice the transverse process. Remember when we were looking in the cervical vertebrae, the transverse process came right off to the side? Well, here on the thoracic, they go more back and off to the side. All right, they're 45 degrees down where we saw the transverse process in the cervical vertebrae come straight out. And the lumbar is similar to the cervical vertebrae because their transverse process also kind of comes straight out. Oh, I got you. And then here's the lateral view of the transverse process. All right, let's march back up to the cervical spine, and we're going to see another structure. Now, this next structure is only specific for the cervical spine. Okay? Don't be fooled. You're only going to find this in the cervical spine. That's the transverse foramen. Called the transverse foramen because it's inside the transverse process. And it's important that you know this. You have an artery that travels inside of that foramen. That's called the vertebral artery. Okay, you have two. You have one on the left and one on the right. And both of those vertebral arteries supply 20% of your brain's oxygen supply. Okay, the other 80% is from the other blood vessel that I told you, which is, that's right, internal carotid artery. Yep, the internal carotid artery, both of them, because you have a left and a right, supply 80% of your blood's brain's blood, sorry. And then the vertebral artery supplies the other 20%, okay? Okay. So here you can see the transverse foramen here on C2. All right, this next slide is going to explain to you, all right, the difference between a process and a facet. So I need some white here so I can draw my picture, okay? So a process is what? A bony projection, right? Right? Bone that is part of the bone that comes off of the main bone, right? So if on a process you have, try to draw it like this, a smooth, flat area, okay? This, I don't know what that was supposed to do. A smooth, flat area, this part here. The process is this whole structure. The smooth, flat area, which I'm highlighting here, that's called a facet. Okay? And a facet is where the facet is going to be the part of the bone that's going to articulate with another bone to form a joint. Okay? The process is that whole bony structure that comes off. That's what this picture is trying to show you. Okay? So this picture is trying to show you that the process is this whole blue structure. And then and you can see it here. This is the process. And then on the process, there's a flat part to it. You can't see it here. You can kind of see it here. It's a flat part. And that's the part of the process that's going to articulate with another bone to create a joint. Because we all agree that when you have two bones coming together to form a joint, we want it to be flat and smooth, right? We don't want it to be rough and bumpy, okay? So that's the difference between, all right, facets and processes, okay? The process, like this is a process. This whole structure right there is a process, okay? But if there was a smooth, flat area on that process, then that would be a facet. Okay? Okay. So what we're seeing here on the superior portion of C2, that's a superior articular process, that whole structure there. Now the arrow is pointing to the smooth portion there. Okay? And that would be the facet. So here's the thing. You might get confused when you're taking the test. So make sure that you read the question if there's a question involved. Okay? And this is for you folks at home too. I am liberal on how I grade the test. If there's just an arrow and it's pointing to that structure right there, if you were to say that's the superior articular process, you'd be right. If you were to say that's the superior articular facet, you'd also be right. That's my point, okay? I want you to understand the difference. The process is, this is a process. That's a bone projection, okay? But this smooth area here on this process, that's also a facet. It can be quite confusing. So this whole structure here is the process, even though it's pointing to the facet area. Okay? All right, so you can see here again, this is another transverse foramen. It's an out of order. All right, so again, I know this is pointing to the flat area there, but it's referring to this whole structure here. This whole thing is a process. So for right now, we're just going to be labeling the processes. So this is the cervical vertebrae. Here is the thoracic vertebrae. That's this whole structure right here. Okay. And obviously, if it's on the top part of the vertebrae, it's the superior one. If it's on the bottom part, it's the inferior one. Okay? Here it is on the lumbar vertebrae. This whole structure here. All right, now I'm going to show you a couple of the inferior articular processes. This is not the best example, and even on the next one here on the thoracic vertebrae, it's still not the best example. The one on the lumbar is a really good example, and usually when I make up the tests on my own, this is the one that I like to use. This is a beautiful one. Whole thing. All right, let's jump back up into the cervical spine. All right, this arrow is pointing to that bifurcated spinous. Remember, we see these two little nubbins going on here. Okay, so you can call it a bifid spinous process or a bifurcated spinous process. All right, so here's the typical spinous process. All right, this is a superior view. Here's the lateral view. And then you can see it here on the thoracic.
When we're labeling these, do you want us to differentiate between thoracic and lumbar?
No, you just put in spinous process. Nope. Yeah, I know. Yeah. You don't want to do that. That'd be a
I
lot.
could probably do cervical, but not.
When in doubt, always put more on the top. All right. All right. Then here's the spinous process for the thoracic from the lateral view, and then you can see it here on the lateral view for the lumbar. Lumbar spinous processes are short and blunted. They're not very long. You can see it here on the superior view then. All right, I'm sure you folks have heard of intervertebral discs. Right, those are the discs, you herniated discs, that sort of thing. That's what you're seeing here. Okay, you have all these discs of fibrocartilage found in between your many, many vertebrae here. Okay? But also, if you look behind them, there's a black hole behind these discs. Right? Inter means between. All right, so these discs are in between two vertebrae. Well, you have these holes here behind them. Those are foramina. And those are also called intervertebral because they're in between two vertebrae. So when we stack a bunch of vertebrae on top of one another, they'll form these little holes. And it's these little holes, these intervertebral foramina, right, in which the spinal nerves exit out of your spinal cord. Okay? So your spinal cord travels down here, and it gives off, we'll talk about this, spinal nerves. And these nerves that just come out of these holes here. Okay, so the disc gets herniated, it pushes on that spinal nerve, and you get pain, numbness, muscle weakness. All right, it presses on that nerve, and it makes that nerve very angry. Makes it say, ouch. That's supposed to be pain signals. All right, here's your intervertebral disc right down here. Fibrocartilage. Does fibrocartilage have a perichondrium? Correct. It's the only cartilage that does not have a perichondrium. Good. Okay. That means hyaline cartilage has a perichondrium, and that also means elastic cartilage has a perichondrium. I had a struggle there. All right, the sacrum. All those 24 vertebrae sit on top of this bone here, your sacral bone. Okay, at one point it was 5 individual vertebrae, but they all fused together. Okay, here's another view for the sacrum. This is the front. Okay, so this portion here on the side, those are called the sacral ala, A-L-A, or ala. All right, and those are like the wings. And if you notice, you have holes here. Well, you guessed it. Those are the sacral foramina. Okay? Again, that's where nerves are coming out.
Is it foramina, multiple?
Yeah. Again, if you were to label it foramen and had 2 arrows there, I would not take off for the grammar.
What was that last one?
Yep, sacral ala. All right, and then you don't have this slide, but I have to show this to you anyways. All right, where the sacrum articulates with your hip bones, all right, this surface here that forms the joint space, that's called the auricular surface. So you can, well, I don't think you had, yeah, all your views are this view here, right?
And the,
Here.
In the posterior, you have this one? No,
well,
what's going on? Way up here? Oh, this one.
kind of, yeah.
Oh, yeah, okay. Yeah, I was gonna say, well,
Same thing, I'm like,
yeah, you have.
You tell me what it is.
Look. All right. I guess the best thing to do is just draw an arrow to the side and write the auricular surface. That's the tricky part. It's the auricular surface. See, one would think you would call it the articular surface, but it's the auricular surface. I don't know. I have no idea why they decided to be cruel. Yeah. Well, the hip bone does, and we'll go over that when we get there. Os coxa, the nominate bone. Yeah, I know. I don't know. You know, something I asked. And here's the crazy part, though, because these are just the terms that we're using. In a lot of these cases, there's several different names for some of these structures. But to try to keep it universal, because you'll come across, because some names are older than others, and it's evolving. And so sometimes I slip into some of the terms that I used when I was going to school. But we're trying to keep up with this just based on that. All right. There we go. Coccyx. That's your tailbone. And I'm gonna make this the last one, because I could try to squeeze in the rest of them, but I don't feel like it. And you guys look tired. And I have to drive until 11 o'clock in the morning, so.
No breaks?
You don't have the coccyx?
Yeah.
You do? It's, okay.
Bathroom breaks?
Oh, yeah, probably. With me? Yeah, because I kept drinking tonight, and I was drinking water, so I know I'm gonna have to probably hit stop. All right.
It's like whenever I'm driving, I have to be.
Oh, yeah. Yep, that's what happens to me. So you have all the information now for your lecture test, okay? I hope and pray that Unlock will be operating and be up to standards Monday. The test, you can take the test on Monday. Most people wait till Tuesday. I don't fault anybody for that. But make sure this Monday, this Tuesday coming up is lecture test 1. Still have class. For those of you that have to be on campus, so come on Tuesday, all right, or you're marked absent. And for you folks here, please sign out on the lab. And if there's any questions, what page is this on? Unfortunately, that's not in the lab manual. So it's on no page. Good luck to everybody. Have a great weekend.
Have a good drive.
Thank you. Thank you
Drive
much. I hope I have a good flight.
I think fine.
I'm gonna wear my swim goggles on the flight, so I don't want the COVID to
Get
get
like
in
some
my
mask
eyes.
and everything too.
Does anyone want to stay behind? Well, who's gonna stay behind with me today?
I can.
Okay, fair enough. All right, folks. Ooh, let me stop recording.